Well, welcome again. Thank you for joining us all for today's event, Psoriatic Arthritis, More Than Just Sore Joints. I'm Katie Schubert. I'm president and CEO of the Society for Women's Health Research, which is the thought leader in promoting research on biological sex differences in disease and improving women's health through science, policy, and education. Through the SWHR Psoriatic Arthritis Program, we hope to raise awareness about the impacts of psoriatic arthritis on women's health and discuss how to improve healthcare and health outcomes for women with psoriatic arthritis. And we are pleased today to have two amazing panelists join us, Elizabeth Medeiros, owner of The Girl with Arthritis, and Leah Howard, president and CEO of the National Psoriasis Foundation. I'd also like to thank the sponsor of today's event, Eli Lilly and Company. And as always, we are live tweeting during today's event. We invite you to join us and use the hashtags SWHR Talks Autoimmune and SWHR Talks Skin on all social media channels. And with that, at this time, I'd like to introduce SWHR Science Programs Manager, Carolyn McPhee, who is moderating today's event.
Thank you, Katie, and welcome everyone. Psoriasis is an immune-mediated inflammatory disease that causes inflammation and overproduction of skin cells, typically resulting in skin rashes, discoloration, and/or raised scaly patches. Psoriatic arthritis, also called PSA, is also an immune-mediated inflammatory disease that is often associated with psoriasis and causes inflammation and damage in the joints, resulting in stiffness and pain. Over 7.5 million US adults have psoriasis, and 30% of people with psoriasis will eventually develop psoriatic arthritis, although psoriatic arthritis onset may be significantly after a psoriasis diagnosis. The average time between psoriasis diagnosis and PSA development is 7 to 12 years. While psoriasis and psoriatic arthritis occur equally in women and men, women report differences in symptom severity compared to men, and may be uniquely affected by different periods throughout the lifespan, such as pregnancy and menopause. Today, our panelists will share ways to empower women with psoriatic arthritis, tools for navigating psoriatic arthritis care, and tips for living well with a chronic disease. Following their presentations, we will have a panel discussion. We invite those of you who are tuned in live to submit questions using the Q&A function throughout the event. I'll now go ahead and introduce Elizabeth, who will be sharing her journey with psoriatic arthritis from a young age. Thanks for joining us, Elizabeth.
Thank you so much for having me. So let me just share my slides and we can get started. Here we go. So yes, hi, I'm Elizabeth. I'm a young adult living with juvenile onset psoriatic arthritis. I'm also known as the Girl with Arthritis, which is my blog and social media. I write about the experience of having juvenile arthritis, of course, and also now as an adult with psoriatic arthritis. And my goal has always been to put out my story because I had such a hard time getting a diagnosis and getting treatment options due to a variety of factors. So today I'd like to share a bit of my story, hopefully to encourage anyone who might be in the diagnosis or kind of treatment, finding out a treatment phase of their journey with psoriatic arthritis, and also just talk about the things that I've learned through the years. So here's a bunch of cute pictures of me. It took me a really long time to get diagnosed with psoriatic arthritis. So my first signs actually started at 1 year old, where I started to have swelling and limping. I got my first flare, really bad flare at age 8. I was actually hospitalized, very swollen, it was very painful. I actually did not get my diagnosis until age 12. There were a few different reasons for this. I was constantly kind of dismissed, or my mom was also dismissed by doctors for lots of different reasons. Poverty could be, kind of a part of that in my earlier years, but also just due to my gender and due to the fact that psoriatic arthritis is not, again, as commonly diagnosed in women, even though it's about half as equal. Like those types of factors that I didn't have psoriasis to begin with too. I was just a very hard diagnosis. And I actually did not get specifically psoriatic arthritis diagnosed until I was 14. So I had a little bit of a hard road. And then I had an even harder road finding treatments that worked. It took a long time, especially because due to insurance, you go through something called step therapy, which is, you're approved for this treatment first. And then once you fail that, now you can try more intense therapies. So it took me very, very long time, as you can see from the timeline, to be able to find something that actually worked out. I'm currently not in remission, but I'm doing very well now. And I am so thankful for that. So enough kind of about my story. I'd really like to just talk about psoriatic arthritis now, and what you can do to advocate for yourself. And my first tip is just knowing that PSA affects your whole body, I think is so important, because, again, it is, an autoimmune issue. But really listening to your body, being able to tell your doctor all your symptoms can help you get to a diagnosis faster. So it's so much more than skin and joints. It's also fatigue. It might be, uveitis, where people have inflammation of their eyes. That's can be very dangerous. You might not feel well. You might have pain in your tendons, which isn't quite joint pain, but it's still very painful. All these types of things are so important, and they should be noted, and, definitely talk about them. I think sometimes as women, we feel a little bit, like you have to push past the pain or only talk about the worst parts. I think especially things like fatigue or sometimes can sometimes be looked at like, oh, that's not that big of an issue, you're okay. But you need to talk about these things. These things are important. Your health is important. My next kind of tip is to build a good healthcare team, and I can't emphasize this enough. The first step, of course, for diagnosis or starting a treatment program is to find the right provider. Typically, that starts with a rheumatologist, but there might be other specialists who are involved. And my biggest thing is, do not be afraid to seek a second opinion, especially if you feel it's necessary. If you get blown off by a doctor, if you just don't vibe with the doctor, do some homework, find a good provider, maybe through National Psoriasis Foundation, the Arthritis Foundation, all those sorts of places. They're excellent resources where you can help, where you can find doctors who really care. And especially if you're offered a patient portal, use it to reach out with your doctor with concerns. Sometimes you can also use them to find other specialists throughout your practice. No two doctors are the same. I've actually had physicians who were more rheumatoid arthritis minded, and they had a little bit of a harder time treating me. So it can be good to try out new doctors if you're just not vibing with the first one. Third is kind of goes with the first, knowledge is power, but it's so important. Educate yourself about this disease. That way you know to speak up and you know what to speak up about. Sometimes it's one of those things that's like, I don't know what I don't know. So it's hard to ask questions at the doctors or, those types of things. So definitely read about your condition from reputable resources. Again, shameless plug for the National Psoriasis Foundation or the Arthritis Foundation. Those are great places to start. There are a lot of other places you can go to. And always make lists of your questions for your rheumatologist appointments, and make sure that you take them with you. Don't be afraid to ask questions like, if you see, maybe new treatment options or alternative treatment options, dietary. Those are not silly things to ask about. And the more you kind of learn about these things, the more you can have that dialogue with your physician. And, kind of along with that notes, tip to bring your questions. I also highly recommend keeping that notebook so you can take notes during your appointment, or even bringing a friend to transcribe. My mom definitely comes to a lot of my appointments. That way we can talk about it afterwards. My fourth and final one is that your mental health matters a lot. Living with chronic pain, going through the diagnosis process, it is extremely draining. So definitely seek help when you need it. Therapy and support groups are very important. It's also really important to know that a lot of people with PSA suffer from depression and anxiety. This is for lots of different reasons. But, regardless of what you're feeling, regardless of what you're ever diagnosed with, whether that's, anxiety or depression or whatever, always keep in mind your pain and experience is valid. It's okay to grieve, and it's okay to feel relieved by your diagnosis. Your mental health, your mental pain doesn't negate your physical pain. So I think that's about it for my session. That was good.
Wonderful. Thank you, Elizabeth. And we will definitely be diving into that deeper in a few minutes when we get to the panel. But thank you so much for getting us started with your story and sharing those initial tips. For those of you tuned in live, again, please note that you can submit your questions at any time using the Q&A box at the bottom of your screen, and we will try to address as many questions as we can during the panel portion of our event. So next, we will have Leah Howard discuss the National Psoriasis Foundation and how they are supporting patient care, advocacy, and healthy living for women with psoriasis and psoriatic arthritis. So welcome, Leah.
Great. Thank you. Thank you so much to the Society for Women's Health Research team for having me here today, and to Elizabeth for sharing her story. Many of the things that she talked about are things that you'll hear me reinforce as well in my comments here. So let's jump on in. So for those of you that are not familiar with the National Psoriasis Foundation, if you want to go to the next slide, I want to share just a really quick bit of history with you about how the NPF was started. So we were actually founded in 1966 through this little teeny tiny ad that you see on your screen here. So Beverly Foster was getting ready to celebrate her 30th birthday. Beverly lived with severe psoriasis, and her husband put this little ad that you see on the screen in the Oregonian, the major paper in the Portland, Oregon area where we were founded. And as you can see, the little ad didn't say very much, but invited people that themselves were living with psoriatic disease to call this number to share information. And in the first week, Beverly received 100 phone calls. And what she said when talking about this later is that not only did she realize that there were other people that were going through the same challenges she was in managing their psoriatic disease, but she saw how many people needed help. And so here was a woman that took it upon herself to try to do something about that. So fast forward about a year and a half, we started as the Psoriasis Society of Oregon and then became the National Psoriasis Foundation. And so for the last 55 years, we have been on this mission to drive efforts to cure psoriatic disease and improve the lives of those affected. And we really do that primarily through doing three things. That's research, education, and advocacy efforts. And so on the right-hand side of the screen, you can see a little bit about how that plays out through our strategic plan. So we have three goals. The first is around leading collaborative transformational research into psoriatic disease. The second is increasing the lifespan and health of individuals living with psoriatic disease. And interestingly, you don't see the skin or joints mentioned in that sentence because, as Elizabeth mentioned, there's a lot of impacts of psoriasis even beyond the skin and joints, psoriasis and psoriatic arthritis, even beyond the skin and joints. And we're really aiming to address all of those issues. And then the third piece of our strategic plan is ensuring we have the resources necessary to tackle those first two items. If you want to go to the next slide. So how does the NPF support individuals living with psoriasis and psoriatic arthritis? And I want to share a few ways. The first, as you see on the left-hand side of the screen, is we have a number of resources specific to individuals that are living with and on this journey with psoriatic disease. I thought Elizabeth's timeline was incredibly powerful, and it showed just for many of us that live with a chronic condition, how it's many years and many interventions and episodes with the healthcare system later that many of us finally get on a treatment that works. And so we have lots of resources that are really intended to meet each individual in our community wherever they are on their journey. We operate a patient navigation center, which is a free resource available to anyone living with psoriatic disease or anyone connected to someone with psoriatic disease. And you could call, email, text, chat, however best you like to communicate with us to get both educational information as well as to get connected with resources that will help with whatever challenge you're experiencing with your disease. We have a mentor program for those that kind of want to talk to someone else who's been there, done that. We have conferences and lots of resources, including both webinars, as well as a very popular podcast program called Sound Bites, which now has over 150 episodes that have reached more than 150,000 people. Additionally, we actually engage with healthcare providers as well. We provide continuing medical education, both to dermatologists and rheumatologists, as well as all the other healthcare professionals. And I want to just touch on one of the things Elizabeth mentioned, which is that challenge of finding a physician that's knowledgeable about your disease. And so through our Patient Navigation Center and through the healthcare provider directory that we have on our website, we have actually a whole network of people that you can reach out to that are knowledgeable about psoriasis and psoriatic arthritis, as well as toolkits to help you prepare for those appointments. Elizabeth gave you a number of great tips, including taking people with you, taking notes at your appointment, writing out questions. Those are all things that we suggest as well at the NPF. You want to go to the next slide? So in the introduction, you heard a number of pieces of data from Carolyn, and I wanted to touch on a couple of those. One is the information about the diagnosis of psoriasis. And so we see these two peaks in diagnosis age. One is kind of in the early years, that 15 to 30 age group. That was actually when I developed my psoriasis. I was in my early 20s. But we see also for many people that there's this latter peak in the 50 and 60 year age group. Interestingly, psoriatic arthritis often comes a few years after that. And so many people find that their psoriatic arthritis diagnosis doesn't hit until, as it says on this slide, about 5 or 10 years after their diagnosis with psoriasis. A few interesting, unique considerations for women are listed here on the screen. If you look at those years and then again, fast forward to that 5 or 10 year period after the initial onset of psoriasis, you see that that really coincides with a number of hormonal changes for women, puberty, primary reproductive years, as well as menopause for women in that latter group. There's also a few treatment options for really any individual diagnosed with psoriasis or psoriatic arthritis. There's really a panoply of treatment options available. That's the good news with psoriatic disease, is when you're connected with a physician or healthcare provider, there's lots of resources that are available to them to help you better manage your disease. But there are some important treatment considerations that are unique for women, and you see some of those listed here. Some therapies are contraindicated for pregnancy. There's also questions about timing having to do with pregnancy with certain treatments. There's the postpartum considerations and then vaccination questions as well. If you want to click forward one more time, we're actually we have a project underway right now that's really focused around developing clinical guidelines to inform healthcare professionals about these unique considerations. So I look forward to coming back and sharing more on that project when that's complete. Next slide. A few pieces of information that I want to share related to sex differences when it comes to psoriatic arthritis. So evidence on this topic is somewhat limited, and I want to thank my colleagues on our research department. I know Dr. Stacy Bell, who was our former Chief Scientific and Medical Officer, worked really closely with the Society for Women's Health Research on some of this at the activities in this area over the last year. Our current colleagues are very invested in looking into these issues further. But a few pieces of data that they wanted to share with you are listed here on the screen. So first of all, there's higher tender joint count at diagnosis for women as compared to males. Longer duration between symptom onset and diagnosis, increased functional limitation, increased impact of quality of life. You heard Elizabeth talk about mental health earlier. We actually did a study in June that found 1 in 3 individuals with psoriasis report being depressed. So there's that's another consideration here. And then greater work disability. And if you're interested in additional information on any of those experiences, you see the citation there on the screen. There's also limited evidence to suggest treatment response differs based on sex. And then compared to males, female experience lower likelihood of treatment response to TFNI and shorter treatment usage, as well as lower likelihood of treatment response to izokibep. Of course, we always say that additional research is needed, and this is certainly one of those areas where we would very much welcome to see researchers continuing to study and continuing to inform the work that patients and providers are trying to do together to help women achieve optimal health outcomes. Next slide. I wanted to also finally just say a few words about diet and nutrition. So I just have 2 remaining slides on that topic. I think, this is an area that the National Psoriasis Foundation gets a lot of questions. And whenever we get questions around this topic, of course, as the information here on the bottom of the slide indicates, we always want to direct you back to a healthcare provider. They are the ones most qualified to work with you to figure out what's going to be best for you in your treatment journey. And we really want to encourage people to treat their disease appropriately. So regardless of what level of disease severity you have, whether you have psoriasis or psoriatic arthritis. We want you to partner with a healthcare professional to find that treatment that's going to be most appropriate for you. And we want to remind people that, especially when it comes to psoriatic arthritis, any dietary intervention should not be considered your sole treatment. So certainly interventions with regard to diet are a great thing to do in combination with a treatment therapy prescribed by your provider, but we do want you having that conversation with your provider to get on a treatment that's going to be appropriate to addressing the joint inflammation that you're experiencing. Remembering again that unfortunately, as little as 6 months of delay between onset of joint inflammation and treatment can lead to permanent joint damage. And so that's really what we're trying to prevent, is that permanent damage to your joints. So a few recommended interventions that came from the work of the National Psoriasis Foundation Medical Board. The first is that for overweight or obese individuals living with psoriatic arthritis, dietary weight reduction with a hypocaloric diet is going to be recommended. Secondly, a trial of oral vitamin D supplementation as an adjunctive intervention to standard psoriatic arthritis therapies is also recommended. Interventions not recommended are listed on the right-hand side of the screen, so you can take a look at those. We do get a lot of questions about this topic, and so did want to address those 2 items as things that are not recommended. Next slide. And finally, I just wanted to speak for a moment to the importance of weight management. So we share here, did you know, individuals who are overweight or obese and who are also living with psoriatic arthritis are less likely to achieve sustained minimal disease activity compared to those of normal weight. So minimal disease activity, or MDA, is what we're going for here when it comes to managing your disease. And so this first point references the fact that being overweight or being obese can challenge our ability to achieve that. We have a few studies here noted as well involving both pain and additional inflammation. And so we really encourage people to talk to their healthcare provider about an appropriate weight for them and work to try to get your weight to an appropriate level so that you are able to achieve optimal health outcomes with regard to your psoriatic arthritis. Thank you so much.
Oh, I was on mute. Wonderful. Thank you so much. Another great presentation. And I know that that was a very quick snippet of all that the NPF has to offer. So again, we are moving into our panel portion. So Elizabeth, you can put your camera back on when you are ready. And we invite everyone who is here live to submit any questions they have as we continue the conversation. Again, just using that Q&A function at the bottom of your screen. We'll try to get through as many as we can in what looks like about 15, 20 minutes left of the program. But to get things started, I think since you just ended on diet, this is a good place to kind of pivot, is talking about lifestyle choices for PSA management as a whole. We know that everyone with a chronic condition finds their own way, finds what helps them best manage their symptoms, diet, exercise, other self-care activities. And it can really vary from person to person what, they feel comfortable doing. So Leah, I was wondering if you could share anything else outside of those 2 slides on diet that the NPF has sort of got recommendations for in terms of self-care for symptom management.
Sure. Yes, thank you. And I think you made the point in your remarks there about kind of the individual journey that we're all on. I think one of the things we talk a lot about, as I've mentioned here today, is working with a healthcare provider that can identify based on your unique characteristics, your unique experience with the disease, what's going to be most appropriate for you. I'm an attorney by education. I'm not a doctor. We don't have dermatologists and rheumatologists on staff. We partner with healthcare professionals who advise us through our medical board and scientific advisory committee. And we don't ever offer medical advice because that's really the role of the provider. So we want to definitely encourage individuals to be talking to their provider and asking them these questions. We do know that lifestyle certainly has an impact on overall health. We did a big campaign during the month of August, which is Psoriasis Action Month, talking about the importance of sleep and stress management. We know that those are two important considerations when it comes to inflammation and achieving good overall health outcomes. So we really encourage people to look kind of overall at their lifestyle and see what they're doing that's leading to optimal health outcomes. Some of those same things are many of the things we talk about in the general population of people. Are you sleeping? Are you eating healthy, good mix of fruits and vegetables, drinking water, getting moderate physical activity 5 days a week? So we recommend those same things that your general practitioner is also going to recommend in order for you to achieve good overall health. Certainly for individuals with psoriatic arthritis, there are sometimes limitations for undertaking some of those things. So for example, with physical activity, you may have some unique considerations. We've worked to put on different programs over the years where you're kind of working with someone who can make some recommendations about how to modify exercise, for example, so that it's best for you with the individual considerations you have with your joints. And so we encourage you to have those conversations with a provider. Definitely visit psoriasis.org and sign up for our emails and our various newsletters, because we do share throughout the year lots of information around these lifestyle topics. And have a lot of information on our website. So if you go to the website, you could search for that. I would also say through the podcast platform that I've mentioned, we've done a number of episodes related to some of these lifestyle questions. And so if you go to our website and click on the little menu on the left-hand side of the screen, you can go to the Media for Patients section. And there you can search by keyword topic and filter for all the different types of media you want, if you want a podcast or a webinar. And listen to experts talk about these topics.
Fabulous. That is a wealth of resources, I think, at our fingertips in terms of those topics and areas on your website. Elizabeth, any thoughts about how you've found specifically in your case, lifestyle tips or anything that you want to add to that?
Yeah, I think especially with psoriatic arthritis, it's just very important to take these things at your at a rate that's comfortable for you. Always check in with your doctor, of course, too. And don't be too discouraged if maybe something doesn't work out the first time. So an example is I couldn't do yoga, even though that's one thing that everyone recommends. As soon as they hear you have arthritis, they're like, oh, go to yoga. That didn't work for me. What worked out for me is going to yoga at the senior center, actually. And when I couldn't do that anymore, I started doing Tai Chi. So definitely just investigate if something's too hard for you. Don't cause yourself that much pain, just, modify until it works for you. And you can use that for a diet as well. If you want to start doing more fresh foods, for example, just one thing at a time, don't do it all at once.
Great. Yeah, I think that's always helpful to remind ourselves, even when you're not fighting symptoms in a chronic disease, that even with the best intentions, we can become overwhelmed, right? So I'm getting a few different questions. I'm going to try to combine some of them. Maybe I'll start with Elizabeth in terms of if you have any specific tips for pain management, particularly in the winter months, and also if there's any foods that you find that like perhaps are increasing inflammation or might be triggering or flaring for you, and then we can pass it to Leah to weigh in as well.
Sure. So I'll start with the first part about that. During the winter months, I think it's really important to stay active. I know that's so contradictory. I love nothing more than to lie in bed and be warm, because that's when my joints feel better. But then, right after I get up, I definitely regret that. So I think definitely try and exercise, but try and find an environment where you can do that while you're warm, to loosen up your joints and just feel comfortable. That could be, going swimming at a YMCA, that type of indoor pool. It could be going to a yoga studio or a community center, somewhere where you're just going to feel a little bit better. I also think compression, if your skin can tolerate, is really good. So compression gloves, compression garments, and whatnot. I always find those are very helpful, especially in the winter, because they do keep you a little bit warm, but they can also help you cope with the swelling. And also just don't wear anything uncomfortable. If you have really heavy winter boots and stuff, that's great, but bring a change of shoes. You're going to be in so much pain by the end of the day. Things like that. And then just as far as food goes, I've been through many, many different elimination diets. I personally haven't found anything in particular that flares me or otherwise, but I will say the things that do help is generally eating fresh as possible. I'll feel better doing that, as well as just mostly I guess just eating fresh, avoiding like fried food, heavy foods that weigh you down, but they don't make me feel very good anyway.
Great. I will offer up a couple of items, and during your next question, Carolyn, I'll drop some links to these things in the chat too. So we have a number of resources on our website. I'm going to start with diet, specific to diet. So there's a few articles that we've done in our magazine called NPF Advanced that are specifically on this topic of diet and psoriatic disease. We also have focused on the question of anti-inflammatory diet and psoriatic disease. So I'll share the links to those resources. We also made a cookbook that I can share too, the link for. So I'll drop all of those in the Q&A. With regard to winter flares, that's a great question. And it's actually something we hear quite a bit about, both for psoriasis as well as psoriatic arthritis in our patient navigation center. Not surprising, right? When we think about, as Elizabeth mentioned, kind of the cold temperatures, I think most folks don't want to get up out of bed when it's cold, whether you live with a chronic disease or not. I know it's always hard to drag my kids out of bed when it's cold outside. And so we do see that a number of individuals experienced additional pain. There's also, for your psoriasis, there's also questions about dry skin overall in general during the winter months. For a number of years, we've created a winter flares guide, which is available through our patient navigation center. And that's been really popular, just again, offering tips for people. And so would encourage folks to reach out to us through the PNC if they'd like any of those additional resources.
Great, thank you so much. And now changing gears a little bit, we have a question submitted, sort of wondering both of your approaches really to COVID and psoriatic arthritis. As we've talked about, these immune-mediated diseases are, of course, a big concern during a global pandemic. And we're returning to normal, but it's still here, right? So thoughts on precautions, lifestyle interventions that we can do to sort of mitigate COVID risk, and anything you have on information about, recommendations specifically for people with psoriatic arthritis in COVID times.
I'm happy to jump in first. So the National Psoriasis Foundation Medical Board worked very closely with our Chief Scientific and Medical Officer, really from kind of the very start of the pandemic, early 2020, to try to put out information specific to our community. We have a COVID resource center that I will also drop the link in the chat too, so folks can access that, where over really the last 2 years, we have placed all of the recommendations and guidance from the National Psoriasis Foundation Medical Board specific to this topic. And just want to give credit to the folks that were leading that effort for the NPF, because it's been an amazing resource. And I think to the point of this question, has really tried to provide in real time guidance from healthcare professionals directly to the community that we serve about some of the considerations. And when you go to that resource center, what you will find is information about both treatment. So the experts, again, I want you to go check it out, but the experts recommend you continue to stay on your psoriatic disease therapy. We always worry when people go off therapy. And so please want to encourage you to stay on therapy. We never want people to make a change to their treatment regimen without talking to their provider first. And I think one of the questions a lot of folks had when the pandemic started was, should I go off my treatment, because there were concerns that maybe they might be more susceptible to negative outcomes with COVID. And so that's one of the pieces that this guidance speaks to, really, again, encouraging people to stay on treatment, also recommending individuals take advantage of vaccines. So that information is up on the website too, and the specific guidance related to the COVID vaccine. So I will drop that link in there and encourage people to check that out. And then certainly if they have any questions, to take those questions to their healthcare provider.
Very helpful. Elizabeth, any thoughts on how you personally have been getting by through the past 2 years that you want to add?
Sure. So definitely, of course, yeah, staying up to date with these patient resources has been very informative, but also listening to my own doctor who, echoed a lot of these things that Leah had just mentioned. I didn't come off my treatments at all. And, I went and got my COVID immunizations as recommended. I've actually just been recommended to go get another one. I'm not looking forward to it, but I know I should be doing it. And I will. Beyond that, just for my lifestyle, I'm very fortunate. I work in tech, so I've been able to work remotely since the start of the pandemic, and it's not something I'm actually willing to part with quite yet. So definitely taking advantages to, or take the advantage to work from home as much as possible. And also, I definitely, the world is going back to normal. I definitely have gatherings and friends and family and stuff. But as much as possible, we do kind of do these events outdoors, or, we kind of take advantage of ventilation, just little things to kind of keep you safe, go a long way, staying out, or, doing gatherings outdoors, opening the windows, just not visiting if you're sick, things like that.
Great. Yeah. Wonderful insights. And actually something you said sparked a light bulb that I would like to kind of pull at that thread a little more. You mentioned your remote work. I'd love if you could share a little bit about how your psoriatic arthritis has influenced sort of your work and school life, if you've needed any accommodations and how you've navigated that, anything that tips that you want to share for anyone on the line who might also be facing some difficulties there.
Sure. Psoriatic arthritis has absolutely had a huge effect on my education and on my work. I've really entered the workforce 4 years ago, so I have a pretty good kind of, feel of what's going to happen going forward. I will say a lot of my symptoms that do affect it are pain, of course. It can be very hard to sit at a computer to focus on classwork or work or just whatever you're doing. Fatigue also has a huge impact there too. It can be really hard to get up early and commute all the way to school or work, do your 8 hours or whatever you're doing and come all the way back and then cook that healthy meal we were just talking about and do that exercise we were talking about and, try and get 8 hours of sleep. It's really, difficult. So ways that I've definitely navigated that are remote work has changed my life completely. But when I couldn't work remote, I tried to live as close to my job or my school as I could. That was an accommodation I got in college. A lot of people don't know that one. But when you're a college student, you can request to have on-site housing if available. So that one's a really big one. I think just taking advantage of any type of like remote learning that you can. And I also think it does pay to be honest with your professors, your teachers, your boss, even to a certain extent. My teachers from when I was, kid in middle school getting first diagnosed all the way through college were all very, very understanding, especially because it was very evident that I was putting in the effort. So I think making sure kind of people know your dedication helps a little bit there. But yeah, asking for those accommodations, asking for the extra set of textbooks to leave at home, things like that. At work, it depends a little bit more. Like if you have a great relationship with your boss, you might be very open to say like, hey, it's very difficult for me to commute. Can I work from home some days? Or can I commute on off hours or something like that? But I guess definitely just know your audience as far as that goes. So I think that's about it. But I could go on and on about accommodations.
I think what you're hearing from Elizabeth is the importance of self-advocacy. And that's something we talk a lot about is, trying to identify what's going to be best for you to help you be most successful. And then talking to those people in your life that either have power over those items or could be a partner for you in getting what you need. So those people close around you, obviously, we want you to build your army of people that are supporting you and nurturing you and helping you to have some of those tough conversations, but definitely want to recommend that you go out and you try to pursue those accommodations or those items that are going to be most helpful to you being able to be successful. We've created some resources that are available through our website. If you go to our homepage and kind of go about 2/3 of the way down the homepage, we have 8 different you find when you click on that link is information that we have curated specifically for people living with psoriatic arthritis to help them on their treatment journey, including some of our kits that our Patient Navigation Center has created. And so would invite you to visit that. And I think what you'll find there is some tools to help you have some of these conversations. So we have one that you can request through the Patient Navigation Center related to workplace accommodations. We also have, for parents, we have some tools that they can use to have conversations with their child's school if their child has psoriasis or psoriatic arthritis and needs some accommodations there too. So I very much agree with Elizabeth that, the more you can go out and kind of push for those things that are going to help you be successful, typically the better outcomes that you're able to achieve.
Wonderful. Thank you both for weighing in. So we are very close to the end of our time. So I want to pitch one last question before we start to wrap up. We get patients, researchers, clinicians, industry stakeholders, healthcare policymakers, all kinds on our webinars. If you could each give one takeaway that you would recommend for these audiences, that you would really want to make them aware of or underscore for them in supporting women along their journey with psoriatic arthritis, what would that be? And I guess since Leah, you just spoke, we'll go with you and then we can go to Elizabeth.
Sure, happy to. So thank you again for having me and for really facilitating what I think was a very important dialogue. Look forward to following up here. I think, the point that I think I would make on this really rich topic is just how complex it is to manage any chronic disease, one like psoriatic arthritis, and how individualized and unique the considerations are for each member of the community. And so if you are a woman living with psoriatic arthritis, a caregiver, a policymaker, a physician, a researcher, I think that the biggest point that I would make is it's important to really understand what's challenging that individual in achieving the best health outcomes they possibly can. There's lots and lots of options available to treat psoriatic arthritis today. And even though they don't quite work as effectively as we'd like them to, I think what we want to impress upon people is that it's so important that individuals living with the disease are able to partner with a healthcare provider who can get them onto the most appropriate treatment for them today, regardless of where they are in their journey, but one that is based on their unique considerations, which really, again, a physician is going to be best able to assess. So I think that the overall point would really be, any chronic disease like psoriatic arthritis is complex and challenging, but by partnering together, we can help individuals living with psoriatic arthritis achieve better health outcomes in the future than they're achieving today.
A really tough one to follow because I agree with so much of what Leah has said. That is very complex disease, and definitely having that team behind you is so crucial in, diagnosis and management and just day-to-day support. So I think what I would say is that, just as the title of this webinar has been, it's more than sore joints. It's so true. This is a very, head to toe disease. It's very difficult to diagnose, to treat, to live with. Sometimes it's hard to see even for physicians. So I hope everyone, physicians and patients and caregivers take away that, it's not just looks. Sometimes these things are very invisible. So definitely listen, investigate, advocate as much as you can. Patients, your body best, fight for it. You deserve all the, treatments and support that we can possibly offer you.
Well, that was really inspiring and very, very comprehensive. Two final statements. So thank you so, so much again for both of your time and for sharing here with us today. And we also want to say thanks to our Eli and Lillian company for their support of this event and SWHR Psoriatic Arthritis Program. To all our viewers, live and recorded, we invite you to connect with us on social media and visit our website, www.swhr.org, to register for future events, download women's health resources, and sign up for our newsletter. Let's continue this important conversation with our hashtags, hashtag SWHR Talks Autoimmune and hashtag SWHR Talks Skin. Thank you all for being here with us today. Enjoy the rest of your evening.